affirming the value of each resident of Illinois. So we're all standing here trying to be physically distanced, trying to model the right behavior, and we're showing our support for the great leadership offered by Governor Pritzker. The members represented here and the people that you've seen at these daily press conferences demonstrate the interconnectedness of all the different sectors of our community. It takes all of us to counter this pandemic. The report for today is sobering, as it is every day. There are 250 additional cases, and there are 4 additional deaths. For Illinois, this brings our total of COVID-19 cases to 1,535, and unfortunately 16 total deaths. It is not easy to be reporting these numbers every day. And we won't fall into the trap of forgetting that these are people with families and friends who love them and people who are worried about them. And for those who have passed on, their loved ones are now grieving and don't have the opportunity to celebrate their lives with traditional funerals and wakes. Let's send our thoughts, our support, and our prayers to all of these families and their friends. This disease has affected every group in our society. It has affected people from ages 0 to 99. In terms of the data that we've collected, 54% of confirmed cases are white, 33% are Black, 5% are categorized as Asian. We have 11% of Latino or Hispanic ethnicity. In terms of severity of illness, our data shows that 16% of COVID cases have resulted in hospitalization. 4% have resulted in ICU admission. Of the lives lost, we see that 92% of those lives lost were in those older than 60. So we see these sobering numbers, and we thank our governor for the aggressive steps that he has taken to try to reduce these stats. He's talking about all that is being done to increase hospital capacity so that we can care for all those that are suffering the most serious illness and eventually decrease the overall number of deaths. Since January, the Illinois Department of Public Health has been working closely with hospitals in response to this pandemic, providing guidance on infection control, diagnosis, and leading the country as the first public health lab to be testing in-state. As the situation has evolved, we began holding weekly webinars with hospitals to provide the most up-to-date information and guidance, but also to hear what hospitals were seeing and what they needed. As information changed and we learned more about this novel coronavirus, we worked with hospitals on guidance for how to safely interact with patients who may be infected and when healthcare workers and staff should stay home. Just yesterday, we had issued additional guidance about screening protocols and triaging patients. Our hospital partners are invaluable, and we must ensure that they have the information as well as the resources that they need. This virus is causing hundreds of thousands of hospitalizations across the globe and thousands of deaths, and we need everyone to understand how severe the situation can be. Let's keep doing our part to help end this pandemic. Continue to stay home. Keep washing your hands. Stay away from hospitals and nursing homes. Let's do everything we can and prevent as many deaths as possible. Now I'll summarize my comments in Spanish.